And hi again, everybody. John Eves. We've got a special guest on the line with us today, Dr. Martin Stallone, Marty Stallone, the Chief Executive Officer. I still call it, of course, Cayuga Med, but of course it's now Cetralus Health, who is leaving to become Executive Vice President of Excellus Blue Cross. And you've been at Cayuga Health for 17 years, and your CEO job is 2018. Marty, congratulations. I know it had to be a tough decision for you, that Cornell grad and everything you had going.
It was a very difficult decision. You know this, I came to Cornell in the 90s. I met my now wife, Amy, came back right before 2010 as a doctor. And really my involvement at Cayuga Health and now Centralus has been in a lot of different capacities. So, clinical and administrative more recently, but I'll remain in the community. I'll remain on the medical staff. We're not moving to take my new job. And so this is, our home and where we're located and where we raised our children. So while the role change was a difficult one to make, I still regard myself as part of the community and I still have more contributions to make.
Boy, you took away one of my next questions. That is fantastic to hear that you're going to stay on the medical staff. I've always wondered because personally, so many folks that I've run into over there, nurses, PR folks, everybody, Dr. Stallone, have so much respect for you. Do you think part of that is the fact that you've been in the trenches, that you've been a medical doctor?
Maybe. I hesitate to speak why anyone feels a certain way about anybody else, but I mean, I have always made decisions in my administrative capacities cognizant of how it impacts the delivery of care clinically to the frontline staff. And so I think that people probably appreciate that.
Dr. Stallone, we're over here in Homer and Cortland, and your footprint is fantastic in our community. Tompkins Street, everything, future plans. I mean, you've really expanded Cayuga Medical and, of course, now Cetralus Health in the central New York community. Can you talk to us about that?
Yes. I mean, we believe in localism. We believe in care being provided in communities close to where people live for the convenience of themselves and their family. We believe in as much happening with respect to the complexity of care within local communities. So if there's something that can be safely done in Ithaca or Cortland or Watkins Glen, our job is to make that happen in a sustainable way because people need ready access to healthcare services at their most vulnerable times. That's our mission, to do that with a high degree of quality and safety in an accessible way. And that's guided our growth and our maturation over the past 7 years. And that's why Centralus Health exists. And so we intend to continue to serve the communities that I mentioned, including others in the southern tier, like Elmira and the Bath area and Chemung County and, into Tioga and other areas of Steuben. So our mission is locally available, high quality, safe, equitable healthcare to the residents in the region that we serve.
We're speaking with Dr. Martin Stallone, who is taking a new job with Excellus and Blue Cross, but we're very happy that he's going to stay in the community. You know what amazes me, Marty, if I can? Technology, especially in medicine. Can I even ask you to look into your crystal ball? Where are we going to be in 5 to 10 years? It's just, to me, fascinating.
Well, Moore's Law talks about kind of the rapid expansion of computing technology and like the acceleration of change. So it's hard to predict even 5 years into the future, but I believe that we're in the industrial revolution of healthcare. Like the 50 years that we're sitting in is going to mark an incredible amount of change with the advent of significant information technology, but other advances as well in the biology space, right? The immunology advances, the cancer advances, they're all changing healthcare extremely rapidly. Artificial intelligence. So I believe within 5 years, there will be more interoperability, more communication between systems. I believe that technology will lead to more facile navigation of patients through what is, by all accounts, a confusing health system to navigate. And I mean the larger US healthcare system. And I think that hopefully it will address some of the workforce challenges that we have. So if we talk about artificial intelligence, is there a way for some of the more routine activities to be done by information technology systems so that we need fewer people to do the same or more work? I think we're going to start seeing that in the 5-year horizon, but it's going to be complicated and there's going to be a lot of false starts, trial and error. And so the industry will continue to progress. And maybe it's a little bit like watching water boil, where you're going to see the impact over maybe you'll look back in 10 years and say, wow, we've come a long way. But along the way, you didn't experience how fast the change was happening. So that's what I think in the next 5 years. There'll be amazing change, and people won't notice it until you look at the change interval over perhaps a decade.
No, I speak for a lot of people when I say I think we're very fortunate in a community like this to have the health care that we do. A couple more, put you on the spot for a second, Dr. Marty Stallone. What are you most proudest of that you have done as a CEO?
I'll give two answers. One is I believe the coming together of different capabilities under Centralus, I'm very proud of. And I don't know that the benefit has yet to be fully realized. I think that's the next chapter of Centralus, is to make it all work together in a facile way. But we've got an amazing number of capabilities under one organization. And so I think that bringing that together has kind of started us toward a vision that's very attractive, and I hope our communities can get behind. Secondly, during the COVID times, even between organizations that are not commonly controlled, that experience demonstrated, and I was proud to have played a role in the cooperation and what cooperation yielded for our communities during that otherwise horrible period. And so it's really bringing the different facets of healthcare together in an orchestrated way, because people need a complicated array of services. There's no single points of service delivery that are sufficient. Most times, people go through the healthcare system needing a lot of different things at a lot of different times. And it's the bringing those things together and the cooperation between organizations and provider types that we all should be striving for. And we've begun that journey.
And you certainly have. Last one, Doctor, I know we're running out of time. I know you're very, very happy that Rob Lawless was unanimously approved by your board to succeed you. I was just looking at this. It looks like you guys have been over at Cayuga Health or Cetralus Health about the same amount of time, 17 years.
Yes. I met Rob in fall of 2009. I have come to appreciate his skill set. He's a systems engineer from Cornell. He's worked in the quality space. He's been the leader of Cayuga Health Partners and been the lead orchestrator of all of the payer relationships for all of the providers within the larger Cayuga Health Partners network. And we have worked very closely together. We share everything I said a moment ago about organizations bringing different skill sets and orchestrating collaborative efforts. He believes in that as well. He's got a deep respect for providers and what nurses, doctors, and other providers and various technicians and all of the hundreds of roles that go into having a competent health system. He respects all of them and what everyone brings to the table. So in short, I'm delighted that he was the choice. In my opinion, he was the obvious choice. And one more comment, I think that what's needed next to pull all of the pieces to Centralus together, he's the right person with the right skill set to accomplish that.
Thank you very much. Anything else as we wrap it up, Dr. Stallone?
Well, I appreciate your ongoing support and your wonderful words about our health system. I think you've been an incredible figure in your community, and I appreciate you.
Thank you, and I want to also give a shout out to Melissa for setting this up. Best of luck to you, Marty, and we'll still see you around the area. That's going to do it. I'm John Eaves on X101.